the right way and there's the wrong way. Okay, the wrong way. Good afternoon, everyone. Thanks for joining us. It is Friday. We moved our schedule around this week and apologize for that, but thanks for joining us this afternoon. I want to get to some important information very, very quickly. Last week and the last 2 weeks, we've talked specifically about a cluster of confirmed COVID cases at the Hedgewood Assisted Living Facility in the city of Beacon. To update you, we are currently aware of, and there has been a total of 74 total cases at the Hedgewood Assisted Living Facility. We are now at only 9 active cases. So we're monitoring 9 current active cases of the total 74 cases that occurred at Hedgewood Assisted Living Facility in Beacon. All of the individuals, residents, remain under quarantine. We're grateful to the City of Beacon, Mayor Kiriakou, and City Administrator Anthony Ruggiero for assisting in the quarantine. But want you to be aware that the spread of the disease at Hedgewood seems to have slowed, and the steps the management and our Department of Behavioral and Community Health have taken is in fact slowing the transmission. But we have now seen 74 total confirmed cases, 9 current active cases. Want to jump to news that you may have learned about today. Yes, in fact, there is another defined cluster at and around Marist College. Currently, there are 12 confirmed cases at Marist College following an off-campus gathering last weekend. Those numbers are not yet in the county dashboard, which I'll get to in a moment. 12 confirmed cases at Marist. Those numbers are not yet added to the county's dashboard. I do want to acknowledge that Marist College, we're very grateful to the administration, responded swiftly and appropriately, working directly with the Department of Behavioral and Community Health. Very grateful to the BCH staff, in particular Jay Landolfi, who's been steering our college campus response. We do know this, though, that contact tracing is well underway. The school has notified, Marist College has notified students, faculty, and staff. They were all notified on Thursday evening. The college has turned today and Saturday to entire virtual or remote learning only. They've suspended all on and off-campus activities, and they have closed the campus to all visitors. Now, the fact that we have 12 confirmed cases is likely to change. It is possible, certainly, that based on that off-campus gathering, that there may be continued transmission. We continue the contact tracing process and testing requirements to identify additional cases. And as I said, those 12 cases are not yet on the county dashboard. So let's go to the county dashboard and give you that update. To date, we have conducted over 184,000 COVID-19 tests, identified 5,222 confirmed positive cases, and we're currently monitoring 127 active cases in Dutchess County. With that in mind, we want to continue to reinforce a few things. One, hospitalizations remain at 10. We've been under a dozen total hospitalizations these last several weeks. But we do expect that hospitalizations could inch up based on those clusters. We'll monitor that. We work regularly with area hospitals. Now, Hedgewood Assisted Living Facility related hospital cases are in Orange County, so they affect the regional hospitalizations, but those individuals were transported to Orange County. And sadly, as you can see, 161 COVID-related deaths, and the last several have been due to individuals contracting the disease at Hedgewood Assisted Living Facility. Now, the regional transmission rate, which again is the total number of positive cases divided by the total number of tests conducted on any given day, remains at about 2%. you'll see now the county numbers. Now, the good news is Dutchess County continues to be the lowest transmission rate of any county in the region, with Orange at 3.9% transmission and Rockland at 7.2% transmission. Now, that relates to the clusters identified in those counties, and we'll get to those in a minute. But Dutchess at 0.3% transmission. Now, again, we do expect that number will climb a bit because of the cases that we are aware of at Marist College. There was another series of cases that certainly we were aware of that came about, and we just continue to monitor those. And you'll see those begin to reflect in the dashboard over the next 48 hours. At the same time, keep in mind that of the total active cases, some will be taken off the list based on meeting the recovery requirements. So I want to say this. Certainly, we have seen the clusters that exist in other counties. We now have been, as I just said, been monitoring several clusters here in Dutchess County. We really want to encourage residents to continue to be vigilant. So the fact that our positivity rate is so low is promising. It's good news. We're very satisfied and grateful for that. But this is a time to remain committed to being considerate to one another's health. And whether it's these clusters that we've identified locally or the clusters identified in other parts of the state, or just what we've witnessed at the national level with the President and First Lady contracting the disease, along with others both in the administration and having some association with the White House, whether they be reporters or otherwise. We know that the disease can affect anyone, and certainly we want everyone to recover. We extend our thoughts and prayers to those who have contracted the disease, the President, the First Lady, and others, and certainly all those within our own community and families. We want folks to recover. But the most appropriate way to slow the transmission of the disease is to adhere to the basic expectations and the guidance that we all have been given. And you've heard me say this now for 8 months. This is about simply being considerate with one another. I really don't have time for the politics, the partisanship, or even party issues. Right now, we're focused on trying to keep our community healthy, get everything open as aggressively, as safely as we can, and these are the steps that, if we take and continue to adhere to, we'll be able to overcome this and slow and continue to keep the transmission of the disease down. So again, remember basic hygiene. Wash your hands using dish soap, hand soap. Entirely appropriate. It's that friction that's created that kills the disease. Using hand sanitizer is always a good option. And again, encouraging folks to engage in that physical distancing. If you're traveling, please do that in small groups. So if you're out in a park, a rail trail, or at an event, we just ask people to keep those groups small, engage in the social distancing with those who are outside of your sort of circle of friends or contacts within your families, and wear a mask. And using and taking those steps will help us to slow the transmission of the disease and keep everyone safe and healthy. As you know, the states of New York, New Jersey, and Connecticut have advised on these these travel restrictions. The state of New Mexico has been added to a list of now 35 states and territories that if you travel to those locations or you travel from those locations, you are asked to self-quarantine. Additionally, I want to say this to friends and neighbors who may be living in areas that are identified as clusters. This is also a good time. If you're in a high positivity rate, if you're living in a community or neighborhood that has a high infection rate, this just isn't the time to travel. You may be healthy, you may not have contracted the disease, and there is no mandatory stay-in-place requirement. But again, if you're living in a community or location or neighborhood where you have a higher rate of transmission, it just is the right thing to do for yourself and for neighbors to try not to travel, try not to go to locations where it would be easy to transmit the disease. Again, as we learned in glaring color nationally, and we certainly know this having experienced this disease and this pandemic for the last 8 months, you don't know if you're carrying it until perhaps you experience certain symptoms or you get tested. So that said, we very much want folks to continue to be safe and to be considerate to one another. We are in on the onset of what is the traditional flu season. For those of you out there who are willing, we encourage you to get a flu shot. And of course, there's somebody probably typing away right now that they don't want to. They're not going to. That's certainly your right. But I will tell you that I personally get the flu shot. My wife gets the flu shot. Our children get the flu shots. It's an appropriate option to vaccinate against the traditional flu, and this is a year to definitely consider getting a flu shot, and those are available at doctors' offices, pharmacies, and retailers like Walmart and Target, and of course the Dutchess County Department of Behavioral and Community Health conducts flu shots on Mondays by appointment, and if you visit dutchessny.gov/flu, you'll be able to get information regarding getting a flu test. So if you have a question, write it in the comment section below the live stream. Happy to get to a few today. We're not in a rush, but we won't keep you all day today. I do want to talk very briefly about our 2021 budget process. In fact, over the next few days, you'll start to see some information being distributed on October the 28th. It's my expectation to present to the county legislature and to you my proposed 2021 budget. I am required to do so prior to November 1st of every year. As you have heard me say, the development of the 2021 budget has been the most complex ever. It just is. Now, we have seen, because of the pandemic and the economic shutdown, a substantial loss in sales tax revenue. I'll get to some good news in a moment. But sales tax revenue, 41% of the county's budget depends on sales tax revenue. That revenue is economically sensitive and therefore is ebbs and flows with economic activity. We are bracing for and have experienced a substantial loss in sales tax receipts. Additionally, expansion of services responsible for a pandemic or response to the pandemic has required us to really ramp up in a lot of areas. That has also resulted in additional cost. Our response to civil unrest this last year has resulted in a significant amount of overtime in law enforcement and other social services. And so the county budget is stressed. Our employees are working hard. We appreciate the great work of Dutchess County staff and employees, and we are preparing for a 2021 budget proposal that estimates as much as a $15 million loss this year, or braces for as much as a $15 million loss in sales tax, and we're preparing for that. So let me tell you that currently we are, as I said, preparing for a $15 million and addressing a $15 million loss in sales tax. Sales tax is collected from you, given to the state, and then the state of New York provides it back to counties. The good news is our last sales tax payment, which we received on the 6th of October, is actually at $21.9 million, is actually 18.5% greater this year than last year. Now, that follows a series of losses, but with that payment coming in at nearly 20% higher this year than last year, we are tracking at currently the estimated $131 million in sales tax receipts for this year, which, if we continue at this pace, will result in about a 6.5% loss in sales tax. So, good news. Last payment was higher this year than last year. We don't expect that to be the norm. We expect it to level off, and if it does level off as we expect that we will end the year with as much as a 6.5% loss in sales tax receipts, which we are preparing for. Now, the 2021 budget will include a few things that I want you to be aware of. We recognize that the last 7 months has been relatively unpredictable, and you want to be able to count on a few things. So you can count on these things. Number one, we are going to spend significantly less money. We will shrink the size, scale, and scope of county spending to address the fiscal concern. We will have held vacant, and we will shrink the county's workforce by as many as 150 individuals. And we will achieve that with no layoffs. So less spending, smaller county workforce, no layoffs, and we will not raise property taxes in 2021. That is our commitment to you and to our staff and county employees. Now, that doesn't mean we're not going to have to work hard to meet your demands and expectations. We're just going to have to be more innovative, more creative, and there will be sacrifices, certainly. Don't expect that we're going to be able to sustain as many services as effectively as we have, but we have core responsibilities, and there are core community concerns like mental health and drug addiction, like responding to the needs of young people, senior citizens, and veterans, like responding and providing for infrastructure and community safety. Those are the things we're going to continue to do effectively. We're just going to have to be more innovative and creative in doing it with as many as 150 less people working for Dutchess County government, which will really shrink ultimately the county's workforce to, really historic levels over the course of the last several decades. So I want you to be aware of that. Let's get to a couple questions, and I'll let you go through there. You bet. So, Susie, why don't these kids take this seriously? I'm guessing, Susie, you're referring to the college students. First, at 45 years of age, I'm not yet willing to call college students kids. But that said, the good news is most of them are. We are not seeing any rampant transmission of the disease. That said, we need college students to respect their health, respect the health of their fellow students, and the public health. So, to the extent that we have the lowest transmission rate in the region, we're not seeing seismic or substantial increases in hospitalizations. Most are following those expectations. Even at our college campuses in Dutchess County, we are not seeing widespread transmission. We're not talking hundreds of students, and we're closing down campuses for good. There are some who are. We are talking dozens at Vassar, Marist, Culinary Institute. We're not aware of any active cases, I think, currently at Bard. And, of course, Dutchess Community College is virtual. The colleges are doing what they should do, and most students are following the expectations as well as you can hope. There are two realities that we confront. College students will always act like college students, and we all have to do more to protect the public's health. So to your point, I do think that many are. We're not seeing any wide-scale concern. We do, however, have the concerns that we've identified, and I am asking college students, who I am much older than these days, to please follow those basic expectations and follow the code of conduct you signed. You signed a code of conduct with your school. You've agreed to adhere to that code of conduct. Please don't overstress the public health system. Please don't jeopardize your own health or the health of your fellow students. Please don't jeopardize public health. And please don't put that pressure on our system and cause anyone to be ill. And that ultimately is what we are asking. Eleni, can we open restaurants to full capacity? Only if the state of New York says so. We've had these conversations. I know that it would be easier if we were making all these decisions locally. The state of New York, through authority granted the governor by the state legislature this last March, is in a position to make those decisions based on his emergency order. We are advocating for a clear path to getting restaurants to higher capacity as the weather obviously turns, and outdoor dining is not going to be an option for much longer. Although we have, through my executive order, relieved any of the obstacles that would deny outdoor dining for the remainder of the year. We know the weather and conditions just may not cooperate, and that might not be an option. So we have asked, and we are really pushing on the state, the counties in the region, to have a plan to help businesses remain open. And I've said this many times, and a number, I will say some people criticize that we're more concerned about the dollar than public health. This is not about that. There are businesses, obviously, who aren't making any money, but they're keeping employees employed. We need employers to remain open. They're the backbone. Small businesses are the backbone of our economy, and that's how our neighbors, that's how you pay your rent, pay your mortgage, pay for daycare, and cover your expenses. The goal, our goal, is to be as safe as possible and as smart as possible, and we're asking the state to accommodate, in particular, larger event venues. Not that you'd want big, massive parties, but they need to be able to function to some degree. And as we get into the colder weather, there needs to be a plan and clear guidance for restaurants to function. And you and I then will make decisions based on our own concern for public health, and we'll continue to aggressively respond from a public health perspective. So we're pushing on the state, and we hope that the state will give some direction. Susie, what's going on with DMV? Are they full open yet? They're not at, DMV is open by appointment. Wappinger and Poughkeepsie are open by appointment. You can do that, and they're at capacity, but by appointment only. So if you want to get to the DMV, you can do that. And, of course, you can do a lot of your DMV activities online, and you can get there by visiting duchessny.gov. Ray, New York City is shutting down schools and businesses in some areas. Is anything like that going to happen in Dutchess? Well, we hope not, and that is really more a product of how safe we are. If you have, and you saw those counties with those high transmission rates, that is because in certain communities, in throughout the state, and in counties in our region, there's just widespread community transmission. We can't have that affect the health and safety of others. So as long as we continue to follow the guidance, as long as we keep our positivity rate down as low as we have, we are in a position to continue to function and ultimately complete, in essence, the reopening process. And we certainly expect that if you were to see spikes of that nature, the state will want to make a decision regarding closure. That is always possible, but we continue to make smart choices and work to keep our numbers down. And with that, we are not yet in a position where we have to confront that kind of challenge. That isn't to say we aren't prepared. Our behavioral and community health staff, regular communication with healthcare providers, regular communication with nursing homes and assisted living facilities and residences for those with disabilities. We are obviously planning and trying to minimize and prevent the transmission of the disease. And we're working with school districts every day to provide greater assistance. We were able to get schools access to rapid testing thanks to PulseMD. We were able to engage in contact tracing as we have with colleges and community-wide, and we're doing it here. So if you have questions, write them down in the comment section. We'll get to a few more points that I wanted to cover this afternoon. Remember, today, is today the last day? This is it for Census? It's probably... we have a little more time. You can keep filling out the census. You can keep filling out the census till they tell us they can't anymore. Visit 2020census.gov. Remember, this is something the federal government is mandated to engage in every 10 years. We're in the process of completing that. We want you to participate. Please, if you've not completed the census, visit 2020census.gov and be counted. This is how billions of federal dollars are distributed based on population. It's how we write lines for election districts and congressional seats. And so please, please, please complete the census at 2020census.gov. Now, today is the last day to register to vote. Here are a few dates for you. Today was the last day to register to vote. October 14th is the last day to submit a change of address. So if you've changed addresses, which happened to me and my wife 2 years ago, and we have to fill out a change of address form, please, you can do that. You need to do that by October the 14th. October the 27th is the last day to apply for an absentee ballot in this state. In order to vote, you have three options. You can vote by absentee, and October 27th is the last day to complete an absentee ballot application. That application goes to the Board of Elections, and the Board of Elections then mails you a secure ballot that you will then participate in, vote, and mail it back in. November 2nd is the last day to apply in person for an absentee ballot, and November 3rd is the last day to mail your ballot or hand deliver it to the Board of Elections or a poll site. So let's do that one last. Again, November 3rd is Election Day. I saw some comments from residents talking about, well, they should all get them in before November 3rd. The law has always been and remains, in this state, you must get your absentee ballot postmarked, meaning mailed, to the Board of Elections no later than November 3rd, or you can hand deliver it to the Board of Elections or your local poll site on November 3rd. So that is key, and that's how you get absentee ballot counted. Now, You can also vote early, and early voting begins on October 24th and is underway until November 1st. October 24th to November 1st, you can participate in early voting. Now, this is in person. You show up to one of 5 poll sites: Fishkill Town Hall in the town of Fishkill, Rhinebeck Town Hall in the village of Rhinebeck, Millbrook Firehouse in the village of Millbrook, the Dutchess County Board of Elections here in the city of Poughkeepsie, or the Boardman Road Branch Library in the town of Poughkeepsie. And you can live anywhere in Dutchess County and go to any one of these locations and vote. So you're off to work, you want to get voting in between the 24th and 1st, you can just walk into one of those locations. You're driving through and you want to vote, you can go ahead and walk into one of those locations and vote in person. You'll fill out a ballot, you'll put it through the scan machine, and your ballot will have been counted. Now, none of that information will be made public until Election Day, which is the third way you can vote. You can show up on Election Day, November 3rd, at your local poll site. So, November 3rd, you can vote in person. Remember, if you choose to vote in person, you'll be asked to wear a mask, you'll be asked to engage in social distancing, and you should expect a little bit of a delay, in particular on Election Day, because there still will be, and rightfully so, a good number of people who are showing up on Election Day to vote. So please participate in one of those 3 ways of voting. And again, you may have been, in this state, you're not sent a ballot, you're sent an absentee application. If you ask for that absentee ballot application, you complete it, and then the Board of Elections will mail you a secure ballot that you can then execute and use to vote. That said, as we mentioned, I think last week, I do want to remind folks, all of this is exceptionally important, the census, voting, and we do want to bring your attention to another opportunity for Dutchess County residents. If you're interested in helping the county legislature draw the legislative lines, we are soliciting for individuals who would like to participate in our Independent Reapportionment Commission. So, on the ballot this November is a public referendum that would change the way the county legislature draws legislative districts. Every 10 years, the legislature is required to reapportion based on population, redistrict based on population. Historically, it is the elected legislators who do that. Last year, the county legislature adopted 3 major public policy reforms: term limits for countywide and county elected officials, independent reapportionment, and an ethics reform package. And the independent reapportionment is now on the ballot. It's subject to public referendum, so you have to vote. I'll be voting yes on the independent reapportionment request. This would take the responsibility of drawing those lines out of the hands of the politicians and put it in the hands of an independent reapportionment commission. My job as executive is to ask you if you're interested in joining and serving on that commission. If you visit dutchessny.gov, you'll see a link to the Independent Reapportionment Commission. You submit your name. If you meet the basic qualifications, which is basically you can't be an elected official, you can't serve in a party on a party committee, I then submit all of those names. So everyone who applies to us, we will submit to the county legislature, and then the Republicans pick 2 people, the Democrats pick 2 people from that pool, and then those 4 people, once selected, will choose 3 more, creating an entirely independent commission that will then engage in the redistricting process. So if you're interested, please join us and visit dutchessny.gov. Lisa asks, as a business owner who deals with the public, she's nervous about the influx of clients from Brooklyn, Queens, Orange, and Rockland. Is there guidance for us to know which travelers we should turn away? Well, you're not necessarily permitted to turn anyone away who doesn't meet the basic guidance. Here's the guidance, and that is, so you wouldn't know if someone's traveling from Rockland County, Greene County, or quite frankly, Florida. They don't necessarily announce themselves. So we are saying to folks who meet those travel requirements, if you're in any one of those 35 states or territories, please follow the state guidance, quarantine for 14 days. I am asking, if you're living in a community that is identified as a cluster, now mind you, that is as much the 11 people who tested positive, or 12 people tested positive in the cluster at Marist, or if you are somehow associated with individuals at Hedgewood, if you know that you have come into contact with or close proximity to someone who may have contracted the disease, please just don't travel. That's our ask of you. Be considerate. That said, if you're interacting with the public, you have every right to deny service to someone who chooses not to wear a mask. That is currently the executive order by the governor of the state of New York. That said, you are to make reasonable accommodation for anyone who may not be able to wear a mask, which could mean please stand outside, call in, and I'll provide your service curbside or by appointment or virtually over the phone. That's within your right as a business person. And if individuals don't want to follow that expectation that you have for your clients and your customers, you do have right to not serve them and ask them to leave. That is your right as a business owner, and that is ultimately the expectation that you should have. So again, we're asking everyone to follow the basic guidance: no large gatherings, social distance, and wear a face covering in public if you can't engage in social distancing. And as a business owner, you can choose to not provide service. And in fact, I think the basic expectation is you should wear a mask in a business setting, and we do ask you to comply with that. And if you can't comply with that because of a public health or personal health reason, the business is obligated to provide a reasonable accommodation, which is, again, curbside, by appointment, or virtually. It isn't they just open the door and you come walking in. Again, if there's a particular concern about any individual or any of the guidance, you can always reach back out to duchessny.gov and connect with the state guidance. But that is the expectation. No formal prohibition on travel. We're just asking people, if you are coming from an area that has a high rate of transmission, is more likely that you may have come into contact with somebody who's tested positive, please just don't travel or be tested so that you can be sure for your own self that you are healthy and not have contracted the disease. I think Miguel, for potential spikes, is there any work being done with local hotels to provide spaces for quarantine? The good news is we have a very active Department of Behavioral and Community Health has been working with providers. We have an entire pandemic response plan that has been tested to its limits this year. Yes, the short answer is we do have accommodations made for those who may have to quarantine outside of their home. And that could be, for instance, you were on a business trip, you came back, and you may have tested positive before coming into contact with a spouse or a family, and you don't want to quarantine and aren't able to quarantine at home. You might be asked to quarantine someplace else. And yes, there is accommodation for that. The Department of Behavioral and Community Health would have that interaction with you and would make that determination. You're living alone, you might quarantine at your house. It may be that your spouse would want you would quarantine at home, and your spouse would stay with someone else or at a hotel. Yes, all of these variables have been taken into consideration, and we are actively using them as is necessary. Deborah, will poll sites be offering PPE and gloves? No gloves, but there will be masks available, and every site is wiped and cleaned after every use. So, again, that's the basic expectation by the state. It's what the Dutchess County Board of Elections, which is independent of my office, but nevertheless is engaged in a basic cleaning process similar to what we use here in county government at the DMV or otherwise. So you'll be expected, again, to socially distance. You'll be expected to wear a mask. I believe there will be medical masks available. We'll confirm that, but I do believe if you don't have one, there would be one provided, but we'd ask you to please come with one. And then pens and poll sites, poll locations where you're actually, the booth area where you're conducting your business is wiped and cleaned after every use. And that's important. Now, keep in mind, gloves are only useful for an instant, right? So if you put your gloves on, you conduct your business. Once you touch something else, the glove is no longer of value. So, and touch your face or something else. So again, their hand sanitizer will be available. There'll be masks. Again, I will confirm, but I do believe there'll be medical masks available. But we are asking you to please wear one. We're asking, the state and the Board of Elections expects that you will wear a mask if you vote in person. And then, as I said, there's steps being taken to make sure that the poll locations and the poll sites are disinfected after every vote cast in any one of those locations. Last couple of things I want to mention to you. Our Office for the Aging continues to be as innovative and creative as possible. If you are a bingo fan, we are hosting 3 drive-in bingo events. So get out your trolls. Is that right? Yeah. Apparently, you don't know this. What are they? Trolls. Good luck trolls? Yes, this is what I know. People who are serious about bingo have good luck things. So it could be your favorite collector. Right? It could be a rabbit's foot, I guess. Do people still do that? I'm really losing it. The Office for the Aging, grateful to Todd Tancredi and the staff. 3 drive-in bingo events for senior citizens across Dutchess County. October 14th at Bowden Park in the town of Poughkeepsie, Dutchess County Park. On October 20th, the Dutchess County Fairgrounds in Rhinebeck, and October 22nd, the Thomas J. Boyce Park in Wingdale, town of Dover. Those are, please visit dutchessny.gov if you'd like to participate. I'll be at one or a couple of them to pull a few bingo balls. That just the things I learn on any given day. Nevertheless, yes, you see them. I'm losing it. That said, please participate. They are filling up pretty quickly, but we want them full. We want you to participate, and we hope you win. And remember, when you win, you just have to yell bingo. I don't know how loud you'd have to. Oh, you're going to honk your horn? That's it. You're going to honk your horn when you win. But if you honk your horn when you don't win, you're going to get a lot of people upset at you. And having experienced that, having gone to a bingo hall and interrupted serious bingo players, I can tell you, you don't want to do that. It's Friday. Friday. We're just going off the rails today. I would like to see that. Fry-yay. Fry.
Fry-yay.
Yay. Thank you. Last 2 items that I wanted to cover today. I'm sorry. First, just a bit of a change in county government. We want to thank, for his years of service to Dutchess County government, Jim Fedorchak. Jim has been an honest and decent advisor to me and a great lawyer to Dutchess County, and has led the county attorney's office for these last years, and I certainly was grateful to have him a part of this administration. He is retiring, and we wish him and his family well, and I'm very happy to present to the county legislature for appointment Caroline Blackburn. Caroline has served as chief assistant to the county attorney. She's comes from a great deal of professional experience and has worked with us for these last several years, and really just a wealth of knowledge, great energy, and a great new addition. And so I will be asking the county legislature to confirm Caroline Blackburn in November to serve as Dutchess County's next county attorney. And we're grateful again to Jim and thrilled to have Caroline continue the great work of the county attorney's office. So I thought you'd like to know that. And you likely know last year we announced the largest expansion of Dutchess County parks in 50 years. And really the crown jewel of that expansion is the Lake Walton Preserve, what will become the Lake Walton Preserve. So the former Lake Walton along the Dutchess Rail Trail in the town of East Fishkill is a part of that expansion. As I said, largest expansion of county parks in 50 years. Our goal here is to create a universally accessible park, passive park, trails, viewing areas, locations where you can take in the natural environment, regardless of ability, universally accessible, adjacent to and attached and connected to the Dutchess Rail Trail. In order to begin the process, we are conducting 2 public sessions where we'd like to get your input. You'll see the diagram here. The step 1 is to create the rail trail connections and an initial loop, so at least we can activate the park. That's step 1 and what we'll be talking about on October 19th and 20th. So we're asking to please look for that information, and if you're interested, to participate in those virtual public sessions. Step 2 will be to ask the county legislature for funding necessary to design the entire facility and develop Friends of the Preserve effort to make sure that we're engaging the public and really creating, as I said, something we're very passionate about through our Think Differently initiative and more. We want to create a universally accessible passive park, and Lake Walton Preserve is going to be a beautiful addition, not only in the town of East Fishkill, but to the Dutchess County park system. If you have no other questions today, we're going to close down just by thanking you, and I'd ask you to join me, as always, in thanking our American Sign Language interpreters. Very grateful. They have been with us for 8 months. For a while, it was 3 times a week, then it was 2 times a week, and then it's been every week. And I don't know if you know this, but I talk fast, and it's not by intent, it's just natural. and they have kept up, and we're very grateful to them. So, ladies and gentlemen, if you have additional questions, visit duchessny.gov, follow us at Facebook or Twitter. In the meantime, be safe, stay healthy, and please be kind to each other.